The newsday continues here on One News Now. I'm Riza Diaz. The Health Department confirms 242 new cases of various COVID-19 variants classified as being of concern. One of the cases is an Indian variant, 104 are UK variant, and 137 are South African variant. The DOH also detected 4 cases of the Philippine variant, which is not yet a variant of concern. Meanwhile, the country records over 7,400 new cases today. The total number of COVID cases now is at 1,200,000. Some 53,000 of them are still active. Now, at least 156 more COVID-19 patients unfortunately died from the disease, while 7,500 recently recovered from COVID-19. Now, are we yet seeing another round of surge in COVID-19 cases in the country? To answer this, we have Mr. Ranjit Rai of the Octa Research Group on the phone. Sir, good evening.
Yeah, good evening.
So, Ranjit, what's your analysis on the recent reports on cases? Are we experiencing a surge again, or this is just a backlog?
Well, there is a real surge in cases the NCR trend is stable. This fluctuation in the heart of the niche response to 5% of it. I think cases in cases
Well, we'll try to circle in back with Sir Ranjit Rai of Octa Research Group. Meanwhile, around 50,000 doses of Russia's Sputnik V vaccine will arrive in the Philippines tomorrow. The Health Department announced that the jabs will be used in a pilot run to assess the country's logistic capability in handling highly sensitive vaccines. Recall that the Russian-made shots need to be stored at negative 18 degrees Celsius and be kept as a frozen solution. The DOH adds that these doses will be deployed to highly populous areas which are seeing an increase in cases.
Actually, according to the National Vaccine Cluster, ibibigay po ito uli doon sa mga lugar na nakikitaan natin ng pagtaas at may high burden of disease. So siguro po mga 2 hanggang 3 lugar muna ang mabibigyan itong mga bakunang to.
Now, here are other stories we're keeping our eyes on. The National Police reports that 3 officers were killed in an ambush by communist rebels in Occidental Mindoro on Friday. At least 9 other policemen were wounded, 6 of whom are undergoing treatment while 3 were discharged. Suspected members of the New People's Army attacked the group's vehicle while securing the delivery of aid to a remote barangay. Vice President Leni Robredo welcomes the decision of the PNP to provide records on the administration's war on drugs to the Justice Department. Robredo described the development as an important first step on the part of the police. The Vice President also lauded PNP Chief Guillermo Elizar for ensuring that they will weed out bad apples from the organization. And President Duterte will lead the prayer for the nation this Sunday called Pray as One, Heal as One. Presidential Advisor for Religious Affairs Bishop Grepor Butch Belica said various faith groups have expressed support for the initiative. Duterte called on church leaders to participate in the event. Now, circling back to our top story, are we yet seeing another round of surge in COVID-19 cases in the country? Let's get that answer from Mr. Ranjit Rai. He's Octa Research Group Fellow. He's over the phone. Sir, good evening.
Good evening.
Sir, again, what's your analysis on the recent reports on cases, and are we experiencing a surge again, or is this just a backlog?
No, this is definitely not a backlog. By and large, we are seeing increases in cases outside of the National Capital Region. The National Capital Region is now experiencing a slow but certain decline in cases. The trend is going down here in the NCR, but outside of the NCR, we are seeing upticks in cases, and there is a very distinct possibility that they will all turn into surges. So that's why we have to increase testing, tracing, and isolation. We have to expand the capacity to treat in these places. What are these places in particular? Particular concern is in Davao City, Iloilo, where a particular concern is Zamboanga, Cagayan de Oro. We're also seeing upticks in Puerto Princesa and in Cagayan Valley. So there's quite a number of places outside of the NCR that are contributing new cases.
So we reported about new variants of concern. Are we seeing a surge on these said variants? And what do you think is the level of transmission now?
Well, based on what the WHO is saying, there is community transmission of these new and more contagious variants, such as the B117 and the South African variant. So these are very contagious variants, and that's why we cannot let our guard down. Our proposal in OCTA is to keep the status quo for the NCR and to heighten the status quo, the quarantine classification, in other places where it is identified that are identified as hotspots, and these interventions will largely impact on mobility. So some of these areas like Davao City may need to rethink their strategy and may need to consider more stricter quarantine status to deal with the uptick in numbers, because these are not just these are variants that are very contagious, and we saw in NCR they're also quite lethal, especially when the hospital capacity is overwhelmed.
Sir, as you said, cases in Visayas and Mindanao are rising. To which factors can you attribute these?
Well, for one, it's a plethora of factors. One is pandemic fatigue. People are not, practicing and enforcing the minimum public health standards. Number two is also mobility of people within the province and outside. People from NCR, and because quarantines are leaky, and testing and tracing is weak. Okay, these kinds of community outbreaks occur, and when these outbreaks are not surveilled very efficiently or effectively, they become surges. And so this is what's happening in the country today. No, we are seeing the spread of these more contagious variants all over the country, and we're seeing the impact of the community transmission caused by the spread of these variants.
Sir, how do you think can the government address the high ICU bed utilization in some regions like Cagayan Valley, Calabarzon, and the Zamboanga Peninsula?
Yeah, this is what often happens when the uptick is not managed, and you'll notice that it hasn't been managed for a few weeks already, because before people get into hospitals, there's a lag of 2 or 3 weeks. So we really need to be aggressive in trying to deal with these surges through expansion of testing, contact tracing, and isolation. What we need now is for regions and provinces to share resources, especially in terms of hospital capacity, which is quite limited in Mindanao. So the government has to come in either by providing beds, ventilators, and manpower to help the regions deal with this uptick in cases.
Sir, is it justified for the government to divert Cebu-bound international flights to Manila?
Well, the decision was well thought out and was practical. And I believe it's justified.
Do you think, sir, we should retain the GCQ with heightened restriction status in the NCR Plus bubble, as we expect, of course, by next week that the government or the IATF will release another quarantine status?
I believe the status quo is important. We need to bring cases down furthermore. We need to sustain the gains of the last month or two of strict quarantine. We are not yet out of the woods, as I often say. While the trend is downward, and that's positive, the total number of cases per day is still above 1,000, 1,100 actually. And that's way above the pre-surge levels of 400 in the National Capital Region. Number two, there's some cities that still, based on the attack rate, still high risk, moderate to high risk. So we need some time to heal, and now is not the time to let our guard down. Now is not the time to rethink or bring down our quarantine status. Now is in fact the time for us to work together to sustain the gains of the last ECQ and MACQ. So this is what we need to do. We don't think we should go to MGCQ. We don't qualify for that. And neither, if we are going to ease up, it should be slow and calibrated as far as certain businesses are concerned to prevent super spreader events.
Finally, sir, what about other areas? Which do you recommend to be placed under MECQ or perhaps other restrictions?
I think Davao City should think about it. The cases are going up, and there are other areas, of course, in the country. We leave it up to the IATF to suggest these. We're coming out with a report next week to look at the trend. Yeah.
Well, thank you, sir, for the time that you spent with us. That's Ranjit Rai of the Octa Research Group. And for more updates, visit News 5, The Philippine Star, and Business World Online. You may also visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. Mask on, wash hands, and stay safe, Philippines. I'm Riza Diaz. We are One News.